haven't gone anywhere.
Yeah, right. Okay, let's get started here. Okay, so let's talk about inflammatory lesions of the hip. Talk about soft tissue infections and inflammatory diseases, and then osteomyelitis. So why don't we start here? Danny, why don't you take this one?
34-year-old male, left thigh pain and liver disease, glucose elevation, A1C, PK. I don't know the normal range, but
Okay. All right. So looks like he has some inflammatory changes and maybe a little diabetes.
Uh,
So what do you think?
so we see extensive signal throughout the medial compartment musculature. Or
See a little bit on the opposite side,
oh yeah,
on the left side. See a lot of central signal lost and then a lot of
yeah,
edema around it, including a lot of edema in the subcutaneous fat.
yeah. So
Here are the axial images.
axial images. Similarly, we see increased edema throughout the muscles and fascia.
Focal low signal areas.
Local low signal areas.
There's ultrasound. Here's the flow. So what do you think? What would you be concerned about?
So some kind of myositis or
Okay.
even
So they were thinking that it was either diabetic myonecrosis or rhabdomyolysis. Okay. Yeah. And then when you have rhabdomyolysis, you want to look at the myoglobin level. It's usually very high. CPK is usually very high. Let's go back here.
with that history,
Kind of high.
excuse me, with that history, the first thing you
I beg
think about is infection.
turned out that this was diagnosed as diabetic myonecrosis, which is probably mostly an ischemic lesion of the muscles, typically treated with antibiotics here and nonsteroidals for pain. And here's 3 weeks later. What do you later?
some atrophy of the muscles.
Yeah, you have to speak into the
Oh, sorry. Looks like the edema has gone down somewhat, but
yeah, on one side. But
yeah, but the other side it kind of looks like it's increased.
right. Okay. So we're seeing bilateral disease.
Oh yeah.
It's primarily affecting the thigh. And this is another month later. It's maybe getting a little better. See the muscle fibers. A little bit flow to them. So they did a biopsy and they found that there was coagulative necrosis, with a lot of acute inflammatory changes. All the cultures were negative. So they confirmed the diagnosis of the diabetic muscle infarction or diabetic myonecrosis. It's pretty rare, but in patients who have poorly controlled diabetes, it's something to be concerned about. It almost always involves the thighs, occasionally the calves.
Well, this patient has cirrhosis also, didn't he?
Liver cirrhosis? How do you know that?
I thought that was one of the things that was mentioned.
Chronic liver disease.
Well, that's cirrhosis to me.
Okay, all right. So, and then, it's more common with type 1 diabetes, but can also be seen in type 2, generally after a number of years, and usually when there are a lot of other complications as well, typically due to poor control. Mostly in the thighs, occasionally in the calves, generally the vastus group. and you get enlargement due to swelling of the affected group, and you start losing the septa, and you get subcutaneous and subfascial collections of fluid. Treatment is better control of the diabetes, and then there are a number of drugs that can be used here. This last one is really a drug that kind of controls inflammation, decreases TNF-alpha. It also increases the deformability of red cells, allowing better a flow of red cells through small vessels. Okay.
Hello. I'm not getting a sound from you.